It comes as no surprise that a recent consumer survey by Statista lists losing weight as one of the top 3 New Year's resolutions for 2023. Every year, millions of people start new diets and ramp up their exercise routines with the hope of achieving this New Year's resolution. However, many don't succeed. So, what can people who struggle with obesity do to lose weight when conventional methods like diet and exercise alone haven't been effective in providing the weight loss results they need? Today, we'll find out. Keep watching. This is You and Your Money.
You and Your Money is brought to you by Doctors Hospital Health System.
Doctors Hospital's pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
Welcome to You and Your Money, everyone. Joining me today to help educate us on treatment options for obesity is bariatric surgeon at Doctors Hospital, Dr. Ranga. Dr. Ranga, welcome to the show.
Thank you for having me.
Now tell us, why for some people has diet and exercise not been enough to achieve their weight loss goals?
That's a good question to start off. I just want to give you a little background on the causes of obesity. So once we understand that, then we know why some people succeed, why some people fail. So there are many reasons actually for why some people are obese. Like for example, genetic is also one of the things. It runs in families. Obesity is definitely a genetic disease, and also the other factors like a poor diet and poor exercise, other psychological problems, and so many other technical problems can cause obesity. So sometimes some patients will try exercise and diet control, and they find that they still can't lose. They will lose some weight, but not enough to improve their lifestyle or improve their life and improve their health. So in those cases, we have to think about other genetic factors. But the good thing is, having said this, once surgery is indicated in those patients, regardless of the cause for the obesity, they always lose weight. So that's the pleasant finding that we see over the years that we do in our experience as bariatric surgeons. Regardless of the cause, after surgery, as long as they stick with the program, the patients will lose weight.
Now, Dr. Ranga, you started to talk about the surgery aspect. Let's talk about some of the treatment options for obesity, and then also I want you to tell us what is bariatric surgery and who is eligible for it.
The term bariatric is the technical term. The common term is weight loss surgery. So the technical term is bariatric surgery, but the common, what people call it as, is weight loss surgery. Both are the same thing. Before I start off into the types of the bariatric surgery, I just want to mention that this is by no means a cosmetic procedure. This is not because it's a common misunderstanding. Many patients come to us and do you get the fat out? Do you do tummy tuck and all of that? It is not that at all. That comes under cosmetic surgery, which is a different specialty altogether. So weight loss surgery is something that we do inside the abdomen with the stomach and the intestines. We do certain procedures that gives you long-lasting weight loss outcomes. So any patient with a 40 and above BMI, we call it as morbid obesity. Any patient with a BMI of 30 and above, but basically 30 and 40, we call that just obesity. So the patients that fall in the surgical category are the patients who have a BMI of 40 or above. So the most common procedure now currently being followed, 70% of all bariatric surgeries now are the gastric sleeve. It's called the gastric sleeve. Again, that's the common term. And the technical term is called laparoscopic sleeve gastrectomy. Basically, what we do is we reduce the size of the stomach. So just remember, the stomach does not mean tummy. Tummy is a common term used to describe the entire abdomen. When I say stomach, the stomach is actually a specific organ inside the tummy. So the stomach, the size of the stomach is reduced by 80%. So the patient will end up having just 20% of their original stomach. So by doing that, we effectively reduce the capacity of the stomach to hold food. And another thing what it does is we remove the portion of the stomach that secretes the hunger hormone. It's called the hunger hormone. Technically it's called ghrelin, but commonly it's known as the hunger hormone. So the stomach secretes that hormone to the brain, to signal to the brain, and the brain then tells you you're hungry, you have to go and eat food. So that part of the stomach is removed. So you won't feel hungry, the patient won't feel hungry anymore. And even if they do get to eat the food, they can't eat too much, not like before, because the size of the stomach is now reduced. So the patient tend to eat less, and they feel less hunger as well. So because of these combinations, they will start to lose weight. And the pattern of weight loss is they will start the weight loss straight away, right after surgery. It's about 1 to maybe 3 or 4 pounds every week initially. And then as it goes along, they lose more and more weight. And the maximum weight loss can be seen about 8 to 12 months after the surgery. So it's a gradual weight loss, which is a good thing. We don't want the patient to lose weight overnight, because then it becomes dangerous. So it's a nice and gradual weight loss over the 12 months. So this is the gastric sleeve. Now the bypass involves also reducing the stomach to a very small little pouch. It's not even and it's less than the size of a fist, basically. So the stomach becomes so small, and then we attach the intestine to that from below. So the benefits of this is the weight loss is more than the gastric sleeve, number one. Number two, the control of diabetes is better with the gastric bypass in the patients that had diabetes to begin with. So these are the two big advantages of the bypass. But like I said, it's got a lot of complications, both immediate and late complications. So for these reasons, we reserve gastric bypass only in particular situations. For example, where the patient is severely obese, basically BMI of 60 or more, and if they have an uncontrolled diabetes. So only in those situations where I will choose the gastric bypass. In all other situations, the gastric sleeve is a good enough operation.
All right, wow, Dr. Ranga, I mean, you know, that is definitely a whole lot of information that you shared with us just now. Even talking about, particularly the thing that stood out to me is having to understand that this is not about a cosmetic procedure. It's about the weight loss journey and getting your health in a better state or position. Now, your colleague, Dr. Janet Martin, is here, and I want to have her join us now. Dr. Martin is the director of the Medical Surgical Weight Loss and Diabetes Program at Doctors Hospital. Dr. Martin, welcome to the show.
Thank you for having me.
Now, Dr. Martin, tell us, what does the assessment of new patients entail?
When the person comes in, we do their weight, their height, and we determine their body mass index. We also do their body composition, which is the level of fat tissue they have in their body, and their basal metabolic rate, and the amount of water that is circulating in the body at the time. A part of the body composition also entails sitting down with the patient and having them share their weight history, their weight gain history. Oftentimes, we find that persons begin gaining weight in childhood, and that's mostly due to the cultural foods and our social environment in which they are brought up in. And so getting the weight gain history over the years is very important. Another aspect of the assessment is going through what the person eats on a daily basis, on a weekly basis. So we do a food recall. I ask the patient, tell me a little bit about your breakfast. What do you eat for breakfast? Do you have breakfast? What do you have for lunch? What do you have for dinner? And do you snack between these meals? A lot of times I find that persons don't call snacking eating. They call snacking, I'm just filling up the time, or I find out from them that they're really not hungry, but they're reaching for food. Another part of the assessment also includes finding out whether some foods they gravitate to certain foods or they just mindlessly eat, and that's a psychological component. We look at their stress levels and their work-life balance, and all of that is entailed in the assessment of a patient who comes in who's either overweight or obese.
Well, Dr. Martin, it seems as though the assessment is a very thorough one based on what it is that you would have indicated just now. But can you give us an idea of the price range for bariatric surgery and whether or not it's covered by health insurance?
Certainly. Bariatric surgery, some insurance companies cover bariatric surgery. Some insurance companies cover it, and they cover the medical nutrition. When we talk about cost, we have to also take into consideration the cost of illness, the cost of obesity. And so there are many, many illnesses that come out of a person being obese, especially if their body mass index is in excess of 40 and above. And so when we look at the cost, we have to look at the cost of long-term obesity and also, think of that in comparison to a one-time payment of the cost for bariatric surgery. So the cost of gastric sleeve is out of pocket for those persons whose insurance company does not reimburse bariatric surgery. Gastric sleeve is $18,000. The insurance company's cost is a little bit more, but there again, it is reimbursed by the insurance.
So with that figure that you would have provided, $18,000, I just wanted to know, is there a payment plan option that's available, or that's a one-time upfront payment?
That's an excellent question. Yes, Doctors Hospital has their LAMP program, and we encourage persons on the initial assessment. Usually I would encourage persons who are intending to pay for the surgery out of pocket to go to the business office or go online and sign up for the Doctors Hospital LAMP program. With that program, the persons then can go to the business office at the time prior to surgery and set up a payment plan for the surgical option.
All right, Dr. Martin and Dr. Ranga, we have to take a quick break, but we have so much more to talk about when we get back. You're watching You and Your Money. We'll be right back.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now.
Go to doctors.
3 advanced facilities at Collins Avenue, Carmichael Road, and Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to You and Your Money. If you're just now tuning in, bariatric surgeon Dr. Ranga and Dr. Janet Martin, Director of the Medical Surgical Weight Loss and Diabetes Program at Doctors Hospital, are here with us today. We're talking about treatment options for obesity. Now, Dr. Ranga, before the break, we talked about the different types of bariatric surgery. I want you to now talk about the non-surgical treatment options available for obesity.
If you remember, I said surgery is indicated for the patients with a BMI of 40 and above. Now, there is a whole category of patients, which is it's quite a big number though, between a BMI of 30 and 40. Yeah? If you remember, I said BMI of 30 and above is called obesity, and BMI of 40 and above is called morbid obesity. So the group of patients that fall between the BMI of 30 and 40 until now had no other option other than the medical weight loss, which means exercise and diet control. So now recently we've had some new breakthroughs, new technologies that we can offer treatment to these patients between BMI of 30 and 40. So the most common in that would be the gastric balloon. Yeah. So it is a balloon like any other balloon, but of course it's different. It's made of medical grade silicone material, and it's very stable and it doesn't rupture. So it's basically placed into the stomach through an endoscope and inflated, so that it sits in the stomach. It fills about half or more than half of the stomach, thereby giving the impression to the brain that your stomach is always full. There's something in it, like a food or water. It mimics food and water. So the brain thinks that there's something in the stomach, so it does not stimulate hunger, and thereby the patient will not feel hunger, and the patient will always feel full, and they'll end up eating or drinking less food. And because of that, there will be some weight loss. It's usually about 30-40 pounds over 8 months. And the patients are happy with that because that's what they need to lose in the lower group. And you must remember that we talked about the gastric sleeve for the heavier patients. So they need to lose upward 80 pounds and upward of 80 pounds. So in that situation, we choose the gastric sleeve. So for the patients who need just 20, 30, 40 pounds weight loss, then we can always choose the balloon. And the balloon, the good thing about the balloon is it's a very short, it's about a half-an-hour procedure. It's a day case procedure, meaning that you don't have to stay overnight. You'll spend 2-3 hours in the hospital, and then you can go back home, and the very next day you can go back to work. And of course, it does have its own drawbacks. Like in the first week, many patients will observe that they have some sort of nausea or vomiting or stomach pain. These are all common side effects of the balloon. It's expected, especially in the first 1 week. So we will give medications to the patients to take for the first 1 week. Once they're past the first 1 week, then it's okay. It's very rare to get symptoms after that. And then slowly the weight loss will start to happen. And then in about 6 to 8 months' time, we have to do another endoscopy, go back in, deflate the balloon and get it out, because it's not a permanent thing. So it can only sit there for 6 to 8 months, the balloon. So it needs another procedure and to get it out. But that is also a minor procedure. That's also another 10-minute procedure.
Now, persons must also understand that no insurance company covers the gastric balloon, despite the gastric balloon itself being FDA approved. And so the cost for the gastric balloon out of pocket is $10,000, and that includes many of the medical nutrition visits with myself. And of course, the $10,000 is the balloon and your visit at the hospital in the theater.
You mentioned earlier that in your assessment you look at psychological factors. How are patients able to overcome issues like emotional eating and food addiction?
We do that by simply identifying. So when I work with persons, I ask them, as I mentioned earlier, what is going on at work? is your job stressful? What are the stressors that you face on a daily basis that is causing you to reach for food? What is affecting you emotionally? Is it your home environment, your work environment, or is it behaviors that are ingrained from childhood? Because we know that growing up, sometimes parents would say to us, eat all that food. You know how many people are starving. Don't waste that food. And so sometimes we begin to develop a relationship with food from childhood that is not healthy. And so to address those issues in the session with me. So when we're sitting with patients, when I am sitting with patients, we look at the food component, we look at the triggers, we look at what is it driving you emotionally to make these changes. We have patients sometimes, they get up during the night if they cannot sleep, and they have a big meal. We have some patients I work with, they hide food in their bedrooms, some children, some adults. So what is it that this food, what kind of comfort do you get from this food that you cannot get from elsewhere, whether it is in relationship with your partner or relationship with yourself? And so we look at that behavioral component. I get them talking, and so that is what really leads them to addressing the emotional aspect. And then, of course, like I said earlier, we have a psychologist that works alongside me. I work with the behavioral side and also the mental, to bring them to the point where if they need to see the psychologist, we refer them to our psychologist.
Okay, well, Dr. Ranga and Dr. Martin, we have to take another break. This is You and Your Money. We'll be right back.
Doctors Hospital's pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now. 3 advanced facilities at Collins Avenue, Carmichael Road in Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to You and Your Money. Dr. Ranga and Dr. Martin from Doctors Hospital are still with us. Dr. Ranga, before we go, talk about the long-term success rate of the various treatment options.
Right, that is a very pertinent question at this time. Exactly. It's important for the patient to know the truth about this, and this is what we explain before any patient undergoes surgery. We tell them all about the goods and the bads, because as a patient, you're undergoing something, you have a right to know what the whole thing entails. So the long-term effects, okay, so the gastric sleeve, for example, the surgery, it is sustainable. It does give a good weight loss, like I said, about 80 to 100 pounds on average, and it will last many, many years, even 10 years or more, but it all comes down to one thing. It depends on you, the patient. You have to follow the instructions that we give, we as in myself and Dr. Martin, that regarding diet and exercise, it is a lifelong thing. There's no shortcut to this. You have to follow the diet restrictions even after the surgery. And if you do that, you can have a lifelong, you can maintain the weight loss for lifelong and have a healthy life. And there's some patients who, after some years, who tend to stray a little bit, okay, I miss eating that, I miss eating this, I love that. And they somehow tend to slowly start going back to their old eating habits. And that's when they start putting the weight back on. But even in that situation, I've never seen anyone go back to their original weight that they had before the operation. So even if they do put on weight, they may put on like maybe 20 pounds, maybe 30 pounds, but they never put back the 80 or 100 pounds that they lost. So that's the good thing that we observe.
Dr. Martin, what do you say to people who may be wondering whether a weight loss procedure is really worth the investment?
Well, first I would like to encourage persons to really search themselves, look at the behaviors that are leading to gaining weight. If you have conditions, then of course the weight loss will help you to live a healthier life, as Dr. Ranga said. And in addition to that, understand that weight loss surgeries is only the tool. You have to put in the work. You have to address those issues that drive you to choose unhealthy foods. And so I say to persons, the weight loss surgeries are beneficial. What is more beneficial is addressing the issues that drive you to choosing unhealthy lifestyle choices in relation to food and lack of exercise. And when you address those issues, then the weight loss surgeries, coupled with healthy eating choices, you will win the battle of obesity.
How can persons get in contact with you?
Our offices are located at the Centerville Medical Center upstairs, and the phone number is 302-3256. That's the phone that rings on my desk, and my cell is 816-7660.
Dr. Ranga and Dr. Martin, thanks for coming on the show today.
Thank you for having us.
Thank you for having us. It's been a real pleasure.
Well, that's it for today's show. Don't forget to follow You and Your Money on Facebook and tune in next week for a brand new episode. I'm Ria Christina. Thanks for watching.